Remote Collaboration and Evidence-Based Care by Stacy Tyler of Capella University in the class of Making Evidence-Based Decisions with Professor Annie Kennedy. Today is November 8th, 2020. Remote Collaboration and Evidence-Based Care. A young girl named Caitlin, age 2, was admitted to the hospital with pneumonia. She had a previous history of pneumonia and meconium ileus. Dr. Copeland diagnosed her with cystic fibrosis and informed the family. She lives with both her father and mother, but they live separately. The disease is new to them both. I will propose an evidence-based care plan to improve the safety and outcomes for Caitlin. Evidence-based care plan. Nursing care plans for patients with cystic fibrosis can vary due to the nature of the disease involving several different elements. For Caitlin, she exhibited symptoms of rhonchorous breath sounds in the upper lobes and decreased sounds at the right bases. Her respirations were 32 and shallow. She had a temperature of 101, and she was noted to be underweight with identification of possible malabsorption of nutrients. Dr. Copeland identified that Caitlin was at risk for pneumonia, impaired gas exchange, nutritional insufficiency, respiratory distress, bowel obstructions, and her parents were at risk for stress of caring for a child with a chronic illness. This evidence-based plan will focus on her risk for respiratory distress. An article by Elborn about cystic fibrosis discussed that morbidity and mortality of cystic fibrosis is mostly caused by bronchiectasis, progressive respiratory impairment, and airway obstructions. Therefore, it is of the utmost importance to protect Caitlin's airway. The goal for her would to be maintain her oxygen saturation above 90% at all times. This can be monitored by her parents spot checking her oxygen level with a pulse oximeter throughout the day. They will also watch for signs and symptoms of respiratory distress as noted in a study by Schmid-Moeller that expressed to watch for signs of breathlessness, loss of appetite, coughing, and increased sputum production. When any of these signs are present, the oxygen should be checked and the parent should determine if Caitlin needs to go to the hospital. By addressing this issue immediately, Caitlin's safety can be improved and her outcome for treatment can be more favorable. The quicker her medical issues are addressed, the better her fate. Her treatment would result in shorter hospital stays because her illness would not be as advanced and she would be able to continue with the normalcy of life more often. In regards to early identification of acute respiratory distress, a study by Zhang specifically compared early and late treatments of over 6,000 patients. The results determined that discovering and treating respiratory distress at a late stage, the patients died more quickly than the early detected patients. To develop a better plan for Caitlin on identifying respiratory distress, further information that would have been useful in developing the plan would be to know how her parents currently determine this and how much they comprehend about the disease and its processes. They may already understand the identification process and therefore could be taught additional factors, or another care plan could have been developed to enrich their skills of protecting their daughter from the illnesses. Evidence-based practice model. The Cystic Fibrosis article by Elborn contains an evidence-based practice model that assisted in developing this care plan. First of all, the model explained the disease in detail, which enhanced my awareness of cystic fibrosis. It identified several factors that resulted from the disease process with great emphasis on caring for the respiratory system. The article stated that the effective treatment of the respiratory distress was important because 25% of the exacerbations they studied did not resolve. In Elborn's 2016 article, he stated that those exacerbations showed a decline of quality of life, reduced lung function, and overall poor survival rate. One way to evaluate the positive benefits to the patient's outcome is to observe Caitlin every day and be mindful of changes in her breathing. If she seemed happy and playful, seemingly eating as normal, and she doesn't appear to have be short of breath, then it is more likely that she's benefiting off of the early parental detection, as noted by no ill-like symptoms. Also, the parents can keep a calendar record of her respiratory distress and review it from time to time. They can make notice of increased exacerbations and possible events that may have taken place during that time that might have distracted them from being more mindful of Caitlin's status. And then they can become more aware during those similar times, and they can be on guard for repeated mishaps. Most relevant and useful evidence. The most relevant and useful evidence that was useful when making decisions regarding the care plan would be contained in the Schmid-Moeller article. The findings about respiratory distress signs and symptoms were the most significant. By teaching the parent these key elements, they can immediately address Caitlin's respiratory issues and possibly prevent negative circumstances that can be as critical as death. The rationale for determining which article was the most relevant and useful when making decisions regarding the care plan involved focusing on which one had information that could absolutely improve Caitlin's condition during a respiratory distress exacerbation event. It was obvious that the Schmid-Moeller article was the most important because it contained evidence-based care that could prevent Caitlin's death. Interdisciplinary collaboration. Caitlin will have a remote team of caregivers, first involving her parents, her primary physician, respiratory therapists, caseworkers, and intermittent hospitalists. Due to the fact that she and her family live in a rural area, there are not many resources available. Using telehealth services would be a great strategy to mitigate the challenge of collaborating multiple team members together through great distances. An article titled Telehealth Use in Rural Healthcare remarked that telehealth allows specialists and subspecialists to virtually visit patients who are not able to come in person, such as those in rural areas. The benefit of using this resource would be that Caitlin and her family would be able to reach several team members more quickly, and they would be more readily available in their time of need. If the interdisciplinary team each chooses to collaborate by utilizing the telehealth system, this can allow for better outcomes in Caitlin's future care because of their immediate response times. They would be, in turn, able to discuss with each other factors involved in her care and offer their expertise versus allowing Caitlin to work with just one specialist. The interdisciplinary collaboration could be better leveraged by establishing a telehealth meeting each week with themselves and Caitlin's parents to discuss her health. By checking in with each other, this can improve her outcomes in the future care situations because the shared knowledge can be built upon with each visit and early detection of illnesses can be identified. In conclusion, although Caitlin and her family have been given unfortunate news about Caitlin's health and introduced to a chronic illness, by using this evidence-based care plan, her outcome can be more favorable. Utilizing information given about respiratory distress and early identification, coupled with using the telehealth system for interdisciplinary collaboration, will offer tools and resources to the family. These will not only be able to address immediate concerns, but they will be able to continuously aid in maintaining Caitlin's health and managing a chronic disease.